about the mouth-heart connection. They say, the thigh bone's connected to the hip bone. Well, the mouth is connected to everything. And in this case, there's a lot that you can do personally to prevent heart attack and stroke just by taking good care of your teeth. Isn't that amazing? Something as simple as brushing your teeth the right way, using the proper toothbrush, can really make all the difference in the world. Here's what we know. We know that some people have heart attacks and strokes, and we just can't figure out why. All the lab, or the standard kind of lab, looks fine, looks normal. But of course, you well know that if you do not ask the right question, you will never get the right answer. So the question that has not been asked in heart disease very often is, do I have inflammation? And as it turns out, that is truly the key to knowing what's going on in that vascular wall, in that blood vessel wall. And what we know is that there is an enzyme called plaque-2, LP-PLA2, and this enzyme kind of latches on to the cholesterol molecule and makes it a bit toxic, makes it ready to be eaten up by that white blood cell and set up an inflammatory response. The plaque-2 level needs to be less than 180 ideally, certainly less than 200. And sometimes, unbeknownst to us, or why, the plaque-2 level would just go up. What was happening? Whereas it turns out, it was discovered that many of these patients did not have a problem with their cholesterol. They had a problem with their gums. They had periodontitis. And after doing some studies and actually looking at specific bacteria in their mouth, what was really going on, what bacteria they had, were they toxic bacteria, not toxic bacteria. We have a slew of bacteria that live with us, some good, some bad. We could discern which of those patients might have a problem with their periodontitis that was causing the inflammation because the plaque-2 was elevated. So the mouth disease caused an elevation in the inflammatory enzyme, which then caused an elevation in the heart inflammation. It's a fascinating idea, and indeed it has been borne out. So what we do for these patients is we check their oral DNA through a company called Oral DNA, and if they are a candidate, we can then treat them sometimes with antibiotics and sometimes just with good oral care. Obviously, they need to see a periodontist, and the periodontist would do their usual scaling, but that is not always enough. And key here is that the periodontist can take a look in your mouth, and he or she may not see a darn thing. It may look fine, but underneath the trenches, within the biofilm, can be some pretty nasty bacteria that then continue to recur and recur. So the key to the heart-mouth connection is good dental care and persistent dental care. Because after you take care of the problem, you have to continue to take care of the problem, or the bacteria will just recur. We can save lives, we can save stroke. It's a wonderful opportunity. It's not expensive, it's easy to do, and it's a wonderful investment in your tomorrow. So hope you learned something today. Go see your dentist, ask him if you have any periodontitis, talk to your doctor and ask him if your LP, PLA2, or plaque-2 is elevated, and if it is, you've got inflammation, you have risk. Ask your doctor to take care of it for you and help you. Thank you very much for your time. Have a good one. Bye-bye now.